Let's take you here now. The COVID-19 pandemic has created food challenges. Food prices have gone up over the past few months, but millions of people are earning less than they were. So how do they feed their families nutritious food and to bolster them against COVID-19? We speak now to Mervyn Abrahams, Program Coordinator for the Pietermaritzburg Economic Justice and Dignity Group. A very good afternoon to you, and thank you very much for joining us. So for the sake of this conversation, we take a look at the October 2020 Household Affordability Index. What exactly does it look at and why does it matter? Mervyn?
It matters because... Hello?
There you are.
Yes.
Please finish your thoughts.
Yes, no, it matters critically because food is at the basis of all human activity. And so if households do not get sufficient and nutritious food, then we will see the impact of that on educational outcomes, on economic productivity, and on our health outcomes in this country. So we track a basket of 44 foods, and the price of that basket now stands at 3,916 Rand, and that is 60 Rand more expensive than it was in September or last month. And the main drivers of that increase has been maize meal, sugar beans, cooking oil, potatoes, and bread. And these are very basic foods that low-income households must purchase every month.
Sure. So 44 food items at just over 3,900 Rand, feeding a family of how many people?
So our household basket is constructed for a household of 7 people, because generally in low-income households, the sizes of the households are generally much larger than when you look at the middle class.
Can't imagine that this goes far in terms of lasting for the month. But taking a look at feeding a child in terms of basic nutritious diet costs, coming in at just over 600 Rand, and the child support grant is 440 Rand.
Yes, so the impact of that, that is a long-standing issue that shows how households are not able to afford sufficient and nutritious food, and the effect of the child support grant being much lower than feeding a child is our stunting statistics. Now in South Africa, 1 out of every 4 boy children are stunted, 1 out of every 3 girl children are stunted. Now we know from what the medical profession tell us that when a child is stunted, through no fault of their own, they cannot use the educational investment we make on that child, and it's very likely that that child will end up as a laborer in the economy later on. So we see a repetition and a cycle of poverty being created by households not having sufficient and nutritious food.
It would seem that, many households just cannot afford these food items. So what is the solution?
So when we're talking about the solution, the first thing we have suggested is that the government should have kept the top-ups to the social grants. The reason being, when the top-ups to the social grants, that's the caregivers grant and the old age grant, was introduced at the end of April, we saw a 27% drop in the level of household food insecurity and hunger. And what we have seen now is at the end of this month, with that being taken away, food prices have increased by 232 Rand over that period, and we are likely to see more households being plunged into hunger.
Mervyn, thank you very much for giving us that perspective. Mervyn Abrahams from the Pietermaritzburg Economic Justice Group.